Hello, and welcome to Quinny Healthcare's Microbiology Lab. Today, we're going to take a peek inside and speak with Jessica Pilone about what a career looks like in a microbiology lab. Hi, Jessica. How are you today?
I'm good. How are you, JB?
I'm good. Thank you for taking the time to chat today. Not too busy in the lab?
Oh, we're always busy in the lab, but it's a good busy pace, not too crazy.
Not too crazy. So what does your role look like in the lab here?
In my role here in the lab, I'm in a sector of the lab. We'll explain more about that later, but I work in microbiology. So I started my shift around 8 o'clock this morning. I'm in charge of the microbiology department, so my days are split up between administrative days and doing scheduling, but then also the actual grunt of that is the microbiology work in the lab. So at a high level microbiology, we really do the nitty gritty testing on bacteria and what causes infections. So for instance, the simplest one is if you have a sore throat and you go to your doctor's office and they take a swab of your throat and they send it. Where do they send it? Usually it's a lab where they send it, and your doctor's not doing it in the background office. Mm-hmm. So the swab comes to the lab, and then we'll look for stuff like strep throat that many people have heard of, and a lot of people have had as being a kid. So, and that is a type of bacteria that we'll try to isolate on like a petri dish and look at it that way. So that's kind of what we do in a sense as microbiology technologists or medical lab technologists, if you want to say. Or if a urinary tract infection or that kind of thing, we'll again identify the bacteria for the doctor, and then we're actually going to tell the physicians and doctors or nurses what kind of antibiotics will work to kill off that bacteria. Wow. So not only are we telling them what's causing the infection, we're telling them what to use to actually fight the infection. So we're producing those antibiotic results as well. So we like to say in lab that your doctor couldn't diagnose you without a lab, or probably treat you without a lab tech being in the background to give you the results. So that's definitely what I do in a day, kind of in microbiology, to a true to sense kind of thing. So we like to play with bacteria in here, but
I'm gonna bring it right back to simple form. So you get sent boogers, spit, and pee.
You're right.
And then you find out why people are sick, and then you're able to prescribe medicine basically.
Yeah, we'll tell the doctor, here's the set of antibiotics that will kill that bacteria, because you want to kill it off. You don't want it obviously sitting there and causing a throat infection or any of that kind of stuff, or runny nose, all that fun stuff. Mm-hmm. And so if they haven't put you on the right antibiotic, they're going to put you on the right antibiotic, and then hopefully all will be well there. So yeah, there is other sections of the lab as well, that if you get your blood taken, where does a tube of blood go? It's pretty much going to the lab. So that's going to tell the doctor how much sugar you have in your blood, or if you're diabetic, and just that kind of stuff. So that's also a huge portion of the lab. If somebody needs a blood transfusion, that's also a big portion of the lab, that we will issue bags of blood to save people's lives out of the lab. So
that all sounds very sciencey. Did you have to take a lot of science in high school?
Yes.
Get to here?
So it is the MedLab Technology Program is an advanced diploma, 3 years with most Ontario. Actually, only a select few of Ontario colleges, and there's one university, U of IT, that will offer the program that you get a degree out of. So there is an option for a degree path. Most of us, the bulk of MedLab technologists, have an advanced diploma. Myself and a handful of people I work with, we did it at St. Lawrence College in Kingston. So that's one of the colleges that offer the MedLab Science program. So you go and do MedLab Science to become a MedLab technologist. And so in high school, you definitely want to take your chemistries, your biologies, math, that kind of thing, for sure. That will be helpful. And those are prerequisites, of course, to try to get into to the post-secondary program of MedLab. But if you really like the sciences, biology, any of that kind of stuff, it would definitely be you would like med lab,
It's
because
the way
that
to
is
go. Okay.
that is it is a lot of science, and more into depth sciences, because then you really break it up. We go into the science of chemistry, the science of hematology, which is your blood cells and that kind of thing, the science of histology, which is human tissue, and then you have microbiology, which is your bacteria, and so on and so forth. So lots of different hubs of science that you actually expand on when you go to college to be a med lab technologist.
Mm-hmm.
So not so much, I guess, the English and the French and your other ones. I definitely did not have that side of the brain, so I was not a good English student. I was definitely a stronger science student, let's put it that way. So I think I found where I needed to be for my career path. That's solid, maybe B student in English, so I just knew it wasn't for me to go and read and write a lot of papers and that kind of stuff, whereas more you're dealing with science reports.
Did you have a lot of laboratory experience when you went to college?
When you do get into the program with MedLab, they have a different kind of setup, simulation labs and that kind of thing. They've come a long way even since when I did the program. So you are actually using the media and the testing analyzers and that kind of thing that you would on the job. So they're really trying to mimic the hospital atmosphere at the college and do simulation labs that patient samples come in and what do you do with it and that kind of thing. It is really good training, and then part of that program is you get a full, I think it's 8 months on-site training in the lab. So we have a student that covers each department for at least almost 6 weeks of a period of time. So the whole third year of your program at St. Lawrence or any of the other Ontario colleges that would offer it, your whole third year is all placement. And that's where you're really going to dive in, work with the lab techs in the hospital, and really get to know the workflow and that kind of stuff in your first 2 years, or the labs in the college themselves, and then theory, of course, you cover. I went into lab science just like a lot of lab techs would tell you, because it wasn't in us to maybe be a nurse or work directly with patients. We're very fortunate that we are a big part of the patient circle and patient care, but we don't work directly with a patient unless we have to take blood from them. And that's usually a lab assistant, not a medical lab technologist.
So what does starting pay out of college for that course look like?
Starting pay here is nowadays, and I mean it comes up with inflation and that kind of thing, but I think a technologist makes out of school now about 36 to 38 an hour to start. So we're really up there, quite close to what registered nurses would make and that kind of thing, starting at a hospital, and you work up from there. A lot of the lab techs max out at close to 45 an hour after a handful of years. I can tell you that with the retiring and a lot of the workforce retiring, we are starving for med lab techs. So you are going to be pretty much guaranteed a job when you're out of school to be a lab tech, because there is a big shortage in the entire country and especially in Ontario. So
if you graduate when you are 18, you take the med lab course, you could graduate and be making $36 an hour by the time you're 21.
And that's exactly what I did. I did it right out of high school, and I graduated at 21. And so my starting job back then was 30 an hour, but again, like I said, it's gone up. But at the time I was very young and very excited to be making
$21.
Yeah, like
21 years old.
21 years old, and making $30 an hour, and it felt great, because the course wasn't super easy, but you work for it, and you study your butt off for the certification exam to actually be able to practice as a med lab technologist in the country and in the province. So. And I've been fortunate in my career that I worked as a technologist out in Vancouver for over a year out there. So there's even flexibility.
Lightning round. What time do you start every day?
8 o'clock, could be 7, could be 9.
Would you ever work a midnight shift?
Yes, depending on the department, you could. Luckily, in microbiology, we don't. We do work weekends. The odd one. Not all of them. You're not stuck working every weekend usually, but...
Do you get benefits at your job?
We do. We got benefits. We are unionized, so you definitely have a union to protect you as well. So, and benefits can definitely be very handy. Dental, all that kind of stuff. You want to see the dentist.
What does a union mean?
A union's just a secondary body of standards, I guess, and a union collective that makes your job just a bit more safe. So a manager just can't come in and say, hey, you're fired for nothing. The union's just there to make sure that the job is a bit more safe, that management doesn't do anything unrealistic or try to cut staff and make people overwork and all that kind of.
Well, there you have it, folks. Some interesting facts about our microbiology lab. Join Jessica for some Q&A and ask her anything you'd like.